Hi Abel, I'm your intern today and I will be doing a cranial nerve test on you. And if you can please pay attention to my instruction, I will be working in your personal space. So I will be first performing the cranial nerve 1 exam, observing the patient's sense of smell. So if I can have you cover up one nostril, please. Okay, close your eyes. And what does it smell like?
It smells like oil.
Okay, oil? What kind of oil?
I'm not really versed in my oils. I don't know what it smells
I
like.
wish you were versed in your oils. That's lemon. Can you cover up the other nostril, please? And give me that one. What's that?
It smells like another oil, maybe peppermint.
Okay, he's right. Okay, next test I'll be performing is a cranial nerve 2, and I'll be observing the patient's visual field. So I'm gonna, this is silly. You're gonna see, well, actually just pay attention to when I come in your peripheral vision, okay?
I'll just look straight. I won't look at the camera.
Yeah, so don't look at the camera, yeah. So let me know when you, just say yes when you see it.
Yes.
Okay.
Yes. Yes.
Okay.
Yes.
Okay, cool. So next I'll be checking the patient's cranial nerve 3, 4, and 6 by having him gaze at me. And and you just need to follow my fingers. I need you to check if your eyes are going the same way, okay? So look at my finger. Okay. And you have no drooping of your eyes. Okay, cool. Next cranial nerve I'm checking is cranial nerve 5, and I'm gonna have this. I'm checking the patient's senses on their face and also their muscles of mastication. Do you have any problems chewing, or do you have any crunching or any pain in your jaw?
No.
Okay, and can I have you bite down? Okay, same. Okay, and then can I have you bite down one more time? Okay, and then can I have you move your jaw side to side? Okay. And then can I have you open your mouth? Okay, and resist. Okay, now push down, resist. Okay. And then can I have you, I'm gonna go down. Okay, cool. Now close your eyes. Do you feel this?
Mm-hmm.
Can you feel this?
Yes.
Can you feel this?
Yes.
Okay, is the pressure the same?
Yes. Yes. Yes.
Okay. Now I'm going to do the ocular cardia reflex. So I'm going to check your pulse for like 15 seconds. Well, not 15, that's too long. Okay, now close your eyes. Push in your eyelids. Okay, can I feel your heart rate again? It should slow down. Yeah, feels like it's slowed down. Okay, cranial nerve 7. I'm checking your facial muscles, and if I can have you make a happy face, a sad face, a pouting face.
Oh, same thing.
I guess, yeah, okay. So can I pucker your lips? Okay, and can I have you lift your eyebrows? Okay, looking good. And do you have any issues with like dry eye in one eye?
Dry just in one eye?
Yeah.
No, usually they're both dry.
Okay, and any dry mouth?
Occasionally when I don't have enough water.
Okay, dehydration. And then do you have a normal taste and sensation?
Yes.
Okay, I'll be checking
Except for in my legs.
Oh, okay. I'm gonna be checking the patient's cranial nerve 8, and I'll be observing the patient's hearing. So, do you hear this rubbing?
Yes.
Okay, let me know when you stop hearing it.
Stop.
Okay, it's pretty good, I guess. Arm length. You're not deaf.
Honestly, I got distracted by them in there.
Okay, I'm sorry. And then we're gonna be testing a patient's cranial nerve 9, and I'm gonna check the patient's gag reflex. So I'm gonna put this spoon in the back of your throat, and I'm just gonna be checking. So if you can just look at me, open your mouth. Okay. Looking good. And then can I have you swallow? Any issues swallowing? Okay. And then I'm gonna be, if you can open, and I'm gonna be checking cranial nerve 10. If you can open your mouth and say ah.
Ah.
Okay. It looks like everything's, the uvula is moving, and so is the palate. And then me checking cranial nerve 11, which is the patient's, observing the patient's spinal accessory nerve. And if I can have you, hold on. Okay. Yeah, do you have any pain, any neck pain when you turn your head?
Mm-mm.
Okay. So I'm gonna put my hands on your cheeks, and if you could push against, like turn your neck against my left hand. Yeah, and then right. Okay, this looks good. Now can I have your shoulder shrug? Okay, that's good. Thank you. Last one, cranial nerve 12. I'm going to be asking the patient to stick out their tongue. Is that the furthest you can go, sir? Okay, looking good. And then I'm going to put my hands against your cheeks again. If I can have you push with your tongue against my left or right hand. Okay, and the other side. Thank you. And that'll be all. That was the cranial nerve test. Thank you, patient Abel.